If someone already has atherosclerosis, it can be treated.
Jak możemy leczyć miażdżycę?
It can be treated surgically. People after a heart attack immediately undergo surgical treatment.
Od razu jest poddawany leczeniu chirurgicznemu.
Here is a picture that shows an area of the heart affected by hypoxia. Lack of oxygen causes necrosis.
Dochodzi do martwicy, tak? Tej części.
Muscles affected by necrosis cannot work, so the heart is unable to pump enough blood due to blood vessel blockage.
Pracuje tak jak powinno, nie tłoczy takiej ilości krwi, jaką powinno tłoczyć, bo doszło do zablokowania.
In that case, the patient undergoes a bypass procedure, also known as coronary artery bypass surgery, also known as CABG. A vein is taken from patient's leg and one end of it is attached to the aorta, whereas the other end to a coronary artery. It is done to restore normal blood flow to a blocked artery. Bypasses are attached where plaque buildup is significant, but heart attack can be caused by detached, small plaques. Only 12% of heart attack-related deaths are caused by large pieces of plaque. 88% of heart attacks are caused by small plaques where bypass surgery is not performed. This procedure may cause complications. It is a possibility in every surgery. 79% of patients after bypass procedure suffer from cognitive function disorders for 7 days following the procedure. Early complications, which can occur within a month after the surgery, are another heart attack, heart failure, and cardiac tamponade, wherein the sternum and the pericardium were cut through during the surgery and a bleeding may have occurred. Blood inside the pericardium puts pressure on the heart, making it unable to contract. Bypass procedure may cause respiratory failure, pulmonary embolism, and neurological disorders, such as strokes. A lot of people who underwent open heart surgery have a stroke afterwards. Bypass procedure may also cause death. Late complications of CABG include narrowing or total blockage of the bypass. I sometimes anesthetize patients who have already undergone bypass surgery twice or thrice. Other late complications include stroke and death. In 33% of patients, angina reappears within 3 years after having undergone a bypass surgery. Half of these patients die, have a heart attack, or their angina reappears within 10 years after the surgery. Heart attack risk is the same in people who have undergone bypass surgery and in those who have not. This procedure does not treat the cause of the problem, just the symptoms, so damaging factors are still active. Angioplasty is a procedure wherein a vessel narrowed or blocked due to a disease, usually atherosclerosis, is widened. Angioplasty is done to widen coronary arteries, carotid arteries, limb arteries, and arteries of internal organs. During angioplasty, a balloon is inserted into a vessel. Then, it is inflated to widen the vessel. A stent, which is a tube that keeps the vessel open, is left inside the vessel. Someone who has a stent in their vessels has to take blood thinners for the rest of their life. Angioplasty can cause complications as well. These include total blockage of a coronary artery, which leads to heart attack and death. Other possible angioplasty complications are hemorrhage and arterial rupture. Keep in mind, arterial walls of people who underwent angioplasty are not elastic, they are weak. Angioplasty may also cause arrhythmias, allergic response and thromboembolic complications, because an alien body is inserted into a vessel, and that promotes thrombus and embolus formation. Within 4 months after angioplasty, 42% of vessels narrow again.
42% naczyń, które zostały poszerzone, z powrotem się zatyka. Ponowne zwężenie dotyka
31% of coronary vessels which have never been widened, 28% of vessels that have been widened once, and 49% of vessels that have been widened twice narrow again. 32% of patients that underwent angioplasty have to undergo another procedure, such as bypass surgery. Angioplasty is not a causal treatment, but a symptomatic treatment. Now I am going to talk about pharmacological treatment of atherosclerosis. I hope you remember what I have told you about this complicated process of cholesterol synthesis. Cholesterol is essential to us. We cannot live without it. Statins are often used to treat atherosclerosis. They are reversible inhibitors of 3-hydroxy-3-methyl-glutaryl coenzyme A reductase. Statins inhibit HMG coenzyme A conversion to mevalonic acid. So if mevalonate is not synthesized, cholesterol is not synthesized as well. No cholesterol means no serotonin and no substrates used in adrenal gland hormones production. Moreover, the skin cannot synthesize vitamin D3 and myelin sheath cannot work properly.
Osłonka mielinowa, tak, pamiętamy z cholesterolu. Zobaczymy, co mówią badania.
Let us see what studies say.
Po pierwsze, okazuje się, że 70%
One research found that 75% of people hospitalized because of a heart attack had less than 130 milligrams of HDL per deciliter. Moreover, 21% of patients were taking statins, so taking statins does not protect from heart attack. 75% of people who have a heart attack have normal levels of HDL. However, we know HDL levels do not indicate anything. Average level of LDL in these hospitalized patients was equal to 104.9 milligrams per deciliter. In another study, 4,162 people who were hospitalized because of acute coronary syndrome no more than 10 days before conducting the study were analyzed. So these people could have had a heart attack or unstable angina. One group was being given 40 milligrams of pravastatins and the others were being given 80 milligrams of atorvastatins in order to achieve cholesterol level of 150 milligrams per deciliter. The study lasted between 18 and 36 months. It depended on the state of each patient. They maintained their diet and 75% of them reacted positively to the treatment. The scientists strived to achieve 150 milligrams of cholesterol in patients because these levels lower the possibility of heart attack and atherosclerosis to zero. 75% of the world's population knows nothing about atherosclerosis. Average level of cholesterol in the Chinese ranges from 90 to 150. I know we are being told not to be scared of cholesterol because it is not the cause of atherosclerosis. You already know that. Let us return to the study. This graph shows the number of deaths and major cardiovascular events in the analyzed patients in 30 months. It turns out that 40 milligrams of pravastatin, where its normal dose is around 5 or 10 milligrams, is less efficient than 80 mg of atorvastatin.
Atorvastatyna w dawce 80 mg jest bardziej skuteczna niż 40 mg pravastatyny. Tak to również wyglądało.
The following conclusions were drawn from this study. Among patients who have gone through acute coronary syndromes, intensive treatment with statins lowers mortality more efficiently than moderate treatment with statins. Moreover, intensive treatment with statins shows the advantages of early implementation of treatment that lowers LDL levels below the recommended norms.
Bezpośrednio przetłumaczone z angielskiego wnioski z tego badania.
During that research, 25% of patients experienced a new cardiovascular event or died within 2.5 years after the start of treatment.
Czyli
Statins do not protect from heart attacks.
chronią przed zawałami.
A week ago, a patient who had a heart attack and was taking statins was admitted to an ICU where I work.
Który doznał zawału serca.
Nobody would ever have a heart attack if statins were as good as they are said to be.
A dzieje się niestety inaczej.
Despite the fact that 25% of patients die or experience a new cardiovascular event, statins are deemed effective.
Lub doświadczyło jakiegoś nowego zdarzenia naczyniowego w przeciągu 2,5 roku, uznano, że to jest bardzo skuteczne leczenie.
I have mentioned depression before, and statins can induce it by lowering cholesterol levels.
Mówiłam o serotoninie. Otóż faktycznie statyny mogą prowadzić do rozwoju depresji poprzez obniżenie poziomu cholesterolu.
Apparently, serotonin not only contributes to the feeling of well-being, but it also prevents us from acting aggressively. In this study, which started in 1965 and ended in 1995, men who were taking statins but did not suffer from any myocardial disease were analyzed. An increase of violence-related deaths in these men was observed. The decrease of serotonin levels induces the decrease of cholesterol levels, which causes aggressive behavior. Low cholesterol levels decrease heart attack-related mortality, but they also cause an increase in violence-related and suicide-related deaths.
Wzrost śmiertelności będący wynikiem samobójstwa lub przemocy. Inne badanie.
In another study, 91,000 people who were taking statins were analyzed. This study found that statins caused a 9% increase in diabetes prevalence, especially in the elderly. Therefore, statins may increase the risk of diabetes. Another research. It was conducted between 1994 and 1998. It says that long-term exposure to statins may increase the risk of polyneuropathy even 14-fold. When my husband was working in Sweden, he anesthetized a 40-year-old fireman. He was being given statins, which induced polyneuropathy in him. He was unable to breathe independently. His nerves were so badly damaged. What is polyneuropathy? It is a disease that affects peripheral nerves. It can manifest itself in movement disorders, weakening and atrophy of muscles, sensory loss, loss of sphincter function, and absence of deep reflexes.
Zaburzenia funkcji zwieraczy lub zniesienie odruchów głębokich, czyli
Taking statins may result in a 4-fold, but even 14-fold increase of polyneuropathy risk. In this study, 114 patients with chronic heart failure were analyzed. They were under observation for a year. Patients with low cholesterol levels had a worse prognosis than those with high cholesterol levels. Latest research suggests that low cholesterol levels may increase non-cardiovascular mortality. Moreover, hemorrhagic strokes are more frequent in people with low cholesterol and ischemic strokes in those with high cholesterol. It was found that some cancer types, such as lung cancer and liver cancer, are more common in people with low cholesterol levels. There are studies that suggest statins may induce cancer. One of them found that long-term statin use increases breast cancer risk. Another study revealed that cancer mortality was 3 times larger in a group of the Japanese who were taking low doses of simvastatins for 6 years when compared to the control group. A relationship between pravastatin treatment and cancer in the elderly was found as well. Another study showed that bladder cancer was more aggressive in people who were taking statins in comparison to patients who were not taking statins. Moreover, statins may induce lymphoma. Twice as many patients from the group that was taking statins developed lymphoma in comparison to the control group. Prostate cancer is also more common in people who take statins. When these people underwent prostate removal, their markers indicating cancer recurrence and aggressiveness were higher when compared to the control group. This is a study from 2014. It says statins lower cardiovascular mortality, but increase cancer mortality, so that general mortality remains unchanged. Here is a scene from a drugstore. The clerk says that this medicine causes depression, polyneuropathy, cancer, insomnia, and so on. The client asks if these are side effects. The clerk says these are the intended effects and that side effects include lowering cholesterol levels. 35% of heart attacks occur in people with cholesterol levels ranging from 150 to 200 milligrams per deciliter. But we know it is not about cholesterol. I have mentioned heavy metals before. They also play a role in atherosclerosis development. Chelation therapy, where EDTA is used, can remove heavy metals from the body. In this study, 1,708 patients over 50 who have had a heart attack were analyzed. The prevalence of strokes, heart attacks, hospitalizations due to angina pectoris and artery widening was assessed. A significant decrease of that prevalence was observed. Chelation therapy had the best effects in the diabetics. There were 4 groups of people. The first was taking placebo instead of both EDTA and vitamins. The second one was taking vitamins and placebo instead of EDTA. The third group was taking EDTA and placebo instead of vitamins. The fourth group was taking actual EDTA and vitamins. The green line represents the results in the group that was taking actual medications. Their results are clearly better. Vitamin C can also be used in treatment. Ascorbic acid reverses endothelial vasomotor dysfunction. It confirms the assumption that oxidative stress contributes to endothelial dysfunction in patients with atherosclerosis. Do you remember the slide with nitric oxide and free radicals which damage the protective enzyme?
jako element uszkadzający enzym ochronny.
Vitamin C protects the body from free oxygen radicals. In this study, ascorbate therapy was analyzed.
Zbadano terapię askorbinianem. W tym przypadku był to askorbinian.
It restored endothelium function in healthy volunteers whose glucose level exceeded 300 mg per deciliter.
Funkcje śródłonka u zdrowych ochotników.
This graph shows the results.
Czyli, proszę
Here we
Państwa,
have modifiable risk factors of atherosclerosis. We can do something about hypertension, smoking, diabetes, obesity, lack of physical activity, high carbohydrate intake, stress, and low omega-3 and high trans fats intake.
Radzić sobie ze stresem, spożywać więcej omega-3 wielonienasyconych, a w ogóle nie spożywać tłuszczów typu trans i mniej nasyconych i walczyć z nadmiarem tłuszczu we krwi. I teraz oczywiście
So you may think I will not mention diet, but now I will surprise you.
Myślę, że Państwa w tym momencie zaskoczę. Czy można
Can proper diet cure atherosclerosis?
Jak zadaję pytanie,
If I ask
to
this
można
question, you
odpowiedzieć
can assume the answer is yes.
tak. I mamy
It has
na to
been
dowody.
proven.
Pierwszy raz
Dr. Lester Morrison was the first person to attempt to prove it. He conducted a research in 1946 where he studied correlation between fat intake and atherosclerosis. We know that saturated fats intake is closely linked to animal protein intake.
zwierzęcego, tak? Było to 100 pacjentów.
Morrison analyzed 100 patients after a heart attack.
Podzielił
He divided them into two groups.
po 50 pacjentów. Jedni stosowali
One group had to follow a low-fat and low-cholesterol diet, which means they avoided animal products.
również zakaz spożywania zup,
They were not allowed to
śmietany,
eat soups with
zakaz
sour
spożywania
cream,
wieprzowiny,
pork,
tłustego
fat
mięsa,
meat,
pełnotłustego
animal fats,
mięsa,
and full-fat milk.
a następni pozostałe
The other patients
pacjentów
did not change their diet.
bez zmiany, bez modyfikacji. Badanie trwało
The
12
study
lat.
lasted 12 years.
Czyli mamy tu 50,
Both groups consisted of 50 people.
50 pacjentów.
A small digression here. I always talk about patients in these studies. I say that 25% of patients died, or a treatment resulted in death of 989 patients.
Notowano 989 zgonów i tak dalej.
However, behind each and every one of these deaths, there is a tragedy.
Kryje się jakaś tragedia.
We should stop looking at these deaths as numbers, but as actual people who had families.
Na przykład, zmarł pan Marek, tak, który był jedynym żywicielem rodziny. Albo zmarła, taka historia.
3 months ago, a mother of two died of breast cancer.
37-letnia mama dwójki małych dzieci opiekowała się później tymi dziećmi jej mama. I 2 tygodnie temu
Then,
pojawił się
her
pan
children were being taken care of by their grandmother, but 2 months later, she died as well.
szczepieniu stentów.
She had atherosclerosis and had undergone an angioplasty procedure.
Kryje się czyjaś tragedia.
Every death is tragic, and every death brings suffering.
Co się okazało? Że po 8 latach 28% tych 28 osób
56% of people from the treatment group in Morrison's study were still alive after 8 years.
a po 8 latach 12 tutaj nadal żyło i po 12 latach
After 12 years, all people from the control group died, but 19 people from the treatment group were still alive.
zmodyfikowały diety, natomiast po 12 latach żyło 19 osób wśród tych, którzy zmodyfikowali dietę. Czyli po 12 latach mamy 19 żyjących, a tu mamy
So people from the control group did not change their diet, and they all died.
to chyba bardziej przemawia.
I think it is more convincing than raw data.
pamiętam, no to byli tacy ludzie 40-50 lat, to nie byli staruszki.
These people were not old.
Inny program
Dr. Esselstyn had a different idea about diet. He started his project in 1985 and focused on seriously ill patients who experienced 49 coronary events in 8 years before 1985. They had angina, heart attacks, they underwent bypass and angioplasty procedures. These people actually had nothing to lose and everything to gain. Conventional medicine could not help them. Dr. Esselstyn recommended them the following: eat nothing that had a mother or a face, so no meat, poultry and fish. Eat no dairy products save for fat-free milk and fat-free yogurts for the first 5 years.
Jogurtu, natomiast po 5 latach zlecił również, aby całkowicie zrezygnowali z nabiału.
Eat nothing that contains fat.
Kropli nawet oliwy z oliwek. Tylko olej lniany mogli stosować.
Esselstyn's patients were allowed to eat vegetables, legumes, whole grains and every fruit but avocado. At the beginning, average cholesterol level of these patients was 246. Throughout the study, it fell to 132. The most important thing is that the disease was not only stopped, but it regressed. I will show you how that was assessed in a moment. Arteries widened by 7% and blood flow was increased by 30% in 70% of the patients. These coronary angiograms were taken before the start of the project and after the end of it.
Przed i po programie. Widać zwężenie?
It took 60 months of vegetable-based diet.
Warzywno-owocowej. Cofnęło się zwężenie. Widać tu zwężenie? Tu nie ma zwężenia. A tutaj jest ciekawa historia. Pracował w tym szpitalu w
This is an interesting story.
Dr. Joe Crow, który
Joe Crow, a surgeon who worked in the same hospital as Esselstyn. Crow had a heart attack in November of 1996 and no surgery could possibly help him because the heart attack occurred in a place that could not be reached.
Czy angioplastyki, czy bypassów. I postanowił wziąć udział w programie żywieniowym doktora Esselstyna, który właśnie pracował w jego
He decided to
szpitalu.
partake in Esselstyn's project.
Była to szczupła osoba, dr Joe
Crow was thin, he did not have diabetes or hypertension, he did not smoke and had normal cholesterol levels. His family also did not suffer from any cardiovascular diseases. I have said that coronary artery disease is often discovered only after a sudden cardiac death. Fortunately, Crow did not die. After 32 months of not taking cholesterol-lowering drugs, Crow's cholesterol levels fell to 89 milligrams. We know why that was so. Crow's diet was very rich in antioxidants, vitamin B6 and folic acid, which caused the restoration of proper vessel function. In this photo you can see that a big part of a vessel was affected by atherosclerotic changes. On the right we have the same vessel after 32 months of a vegan diet, without taking any cholesterol-lowering drugs. Five patients gave up and sought conventional medical treatment. In 1995, new coronary diseases occurred in them. In 2003, so 17 years into the project, almost everybody who was following Esselstyn's recommendations was alive. Only one person had died. These people barely walked. Esselstyn wrote about it in his book, Prevent and Reverse Heart Disease. Some of his patients were on the verge of death. There was another doctor who cured myocardial disease with diet. Esselstyn would give his patients small doses of statins, but Dean Ornish managed to cure these diseases only with diet. 28 of his patients followed a low-fat, plant-based diet, and only 10% of caloric intake came from fats. There are recommendations saying that 30% of calories should come from fat, but it is actually too much. Patients could eat however much they wanted. Moreover, they had to do breathing exercises and meditate for an hour each day in order to lower their stress levels. They also had 3 sessions of physical exercise every week. 20 patients formed a control group that was being treated with statin drugs. Average cholesterol level in the treatment group fell from 227 to 172. LDL also fell from 152 to 95. Their arteries widened by 4% after a year. In the control group, further narrowing of the arteries by 8% was observed. The disease reversed within a year in the people who were following the diet. Moreover, frequency of coronary events decreased by 91% in them. For the sake of comparison, frequency of angina in the control group increased by 165%. How is that even possible? We live and die at a cellular level. Cells have to be provided with organic food full of vitamins and microelements so that the cells can live longer. Our cells are subject to the laws of nature, not our whims. I think smokers have something that can be called God syndrome. They think they are immortal and they can smoke since they will die sooner or later. However, they quickly change their opinion after surviving a heart attack or discovering they have lung cancer. Sadly, it is too late to change anything for them. Cells have life cycles. They die, and new ones come in their place. I have mentioned erythrocytes. They live 72 days, and then they are replaced by new cells. The old ones disintegrate and are disposed of. Enterocytes, which are found in the small intestine, live for a week. Lung and heart cells also undergo these processes. Although neurons do not die, there is such a thing as neuroplasticity, so connections between neurons can change throughout life. Skin regenerates itself approximately every 3 weeks. The same thing happens in bones, intestines, nails and hair. When you begin to provide the body with all the substances necessary to build new cells, they will be healthy. They will not malfunction. This is the secret of every diet. Esselstyn, Ornish, Morrison, Dąbrowski. Regeneration
To
is
jest
the secret,
To
the
jest
body's
nasze
ability to regenerate.
zdolności regeneracyjne, nasze zdolności do samouzdrawiania. Ile bym
I could read all the books and know about every case, but whether we like it or not, vegan diet is the one that treats cardiovascular diseases.
Dieta wegetariańska to jest ta dieta, która leczy.
Your food has to be organic and unprocessed.
Przetworzony, to jest bardzo ważne.
Some of you may know that. Say a whole grain roll contains 100% of zinc, magnesium, vitamin E, folic acid, chromium, vitamin B6, and fibers. A Kaiser roll made with white flour contains 5% of vitamin E, 22% of vitamin B6, 22% of fibers, 50% of folic acid, 28% of magnesium, and 38% of zinc.
Ma już tylko 22% witaminy B6, 22% błonnika, tylko połowę wartości kwasu foliowego, 28% magnezu i tylko 38% cynku. Czyli tak naprawdę
You would need 20 Kaiser rolls if you wanted to get the amount of zinc you would get from one whole grain roll.
Wykonana z mąki z pełnego przemiału. Trzeba 5
A single whole grain roll contains 5 times more chromium, magnesium, and vitamin B6 than a Kaiser roll.
Ile ma bułka wykonana z pełnego przemiału? Jeżeli będziemy
Eating processed food brings nothing but diseases and suffering.
Przetworzonym, to co niestety zafundujemy naszemu organizmowi, to choroby i cierpienie. Bo każda choroba,
Suffering is a symptom in every disease.
Cierpienie. Jeżeli nie dla
If it is too late for somebody, maybe their family will benefit from my advice.
smutku po jego utracie. Albo muszą się opiekować tym pacjentem. Zazwyczaj
We usually worry about protein intake.
na 100 kg
100 calories of broccoli provides 11 grams of proteins, whereas 100 calories of a steak provides 6 grams of proteins.
w brokule i białka jest 6 gramów w steku wołowym. Weźmy tutaj
This is a comparison of broccoli, steak, romaine lettuce, and kale.
teraz to jest bardzo dużo danych. Białko. No wychodzi, że jarmuż ma więcej
100 calories of kale has more proteins than the same amount of steak.
kalorii białka niż stek wołowy. Tutaj ktoś może mieć zastrzeżenie, że to
Somebody
jest
may say that I should show values per 100 grams, but it would be misleading.
Oszukiwania nas. Bo my jemy, żeby pozyskać
We eat for caloric intake,
żeby
not for
pozyskać
mass intake.
tak? I wprowadza się takie pojęcie jak gęstość.
There is a term for that.
Cukier ma
Nutrient
gęstość
density.
0, czyli ma bardzo dużo kalorii.
Sugar's nutrient density is close to zero.
Nie ma żadnych
It has many calories,
właściwości.
but almost no nutrients.
Natomiast
However, broccoli, kale, carrots, they have little calories and plenty nutrients in the form of vitamins and microelements.
w postaci mikroelementów, w postaci witamin. Tak? Proszę
Broccoli
spojrzeć,
contains 118 milligrams of calcium, whereas steak just 2 milligrams. Romaine lettuce has 184 milligrams of it, kale 257. People worry about calcium and where to take it from. Now you know. Iron. Broccoli has 118 milligrams, steak 0.8, lettuce 5.7, kale 3.2. Magnesium. Broccoli contains 46 milligrams of it, steak has 6 milligrams, 82 milligrams of magnesium are in lettuce, and kale has 64 milligrams of it. Potassium. Only 74 milligrams in steak, many times more in vegetables. Vegetables contain a lot of antioxidants and phytochemicals, unlike steak, which has none.
Bardzo dużo.
Folic acid, 200 micrograms in broccoli, 46 in kale, 800 in romaine lettuce, and just 2 in steak.
800 w sałacie rzymskiej, stek,
Vitamin C, A, and beta-carotene.
niacyna.
Steak contains none of them.
C, witamina A,
Vegetables are very rich in them.
a tutaj ile jednostek?
Saturated fats, none can be found in vegetables.
Tak, a tu są. I tutaj masa produktu 29 gramów, 588 gramów, 357. Zwróciłam uwagę na ilość. Tak jak wcześniej powiedziałam, że cały czas się boimy objawów.
Out of curiosity, I have written down how much protein per 100 grams can be found in various foodstuffs. It turned out that chlorella, dried algae, is the richest source of proteins. It contains 56 grams of proteins for each 100 grams.
56 gramów 56
Dry soy seeds have 35 grams of proteins. Barley grass juice has 28 grams. Tilted cheese and dry lentil seeds contain 25 grams of proteins. Pea has more proteins than ham and chicken breast. Bean has more proteins than low-fat cottage cheese and beef. Coronilla has more proteins than pork liver, high-fat cottage cheese, pork chop, and cod fillet.
A co zupełnie mnie zaskoczyło, gdzie tu jest, że płatki owsiane
Oat flakes have more proteins than sausages and eggs.
My się cały czas boimy o to białko.
We constantly worry about protein deficiency.
Nam go zabraknie. I też ja już nie chciałam przedłużać wykładu, ale tak naprawdę świat...
The truth is, plants have all amino acids necessary for us, so those we cannot synthesize ourselves. We were told proteins are found only in eggs and in meat. Latest research shows proteins can be found in plants as well. Many studies indicate that a vegan diet is healthy. One study focused on the medical costs of meat consumption. Meat induces diseases and curing them costs money. Another one's name is Animal versus Plant Foods in Human Diets and Health. Is the historical record unequivocal? In the past we thought that cavemen ate meat exclusively, but it turns out they ate plant food as well. Their hunts were not always successful. They did not have guns or supermarkets. They could not store meat for longer periods of time.
Bo go nie mógł na co dzień upolować, nie miał zamrażarki, żeby przechować i tak dalej, i tak dalej.
So, whom should you believe?
Czy mi? Bo, prawda?
Opinions are so divided that the man in the street does not know what to do and whom to believe. I cite many studies, but are they true? You have heard about Atkins's diet, haven't you? It is a slimming diet, widely popular in the USA. Atkins wrote a book, Dr. Atkins's Diet Revolution, and it became a bestseller. 12 million copies sold.
Książka, mnóstwo tysięcy, milionów zwolenników, ma 12 milionów sprzedanych egzemplarzy.
Dr. Atkins had hypertension, coronary artery disease, and heart failure. In 2002, he had a heart attack. A year later, he died. He fell over, had a hematoma, and died. He lived 73 years. It is not enough to convince me that his diet is healthy. Some time ago, I told my aunt that I stopped eating red meat and pork. She thought I was going crazy. When I told her I was going vegan, she told me that I had completely lost my mind. I looked at her and told her that she had hypertension and osteoarthritis. Her gallbladder had been removed. She had chronic backache. I asked her if these things were the proof that her diet is better than mine.
Proszę? No cóż mogła powiedzieć, no masz rację.
This is Dr. Ellsworth Warham. He is 95 and he is still able to perform surgeries.
On od 50 lat
He's a vegan.
Jest weganinem.
He is a Seventh-day Adventist as well. They are an interesting Christian denomination which has been analyzed in every possible way. It includes their diet, dietary habits, and the influence of their diet on health. Average Adventist lives 8 years longer than his neighbor who does not share their faith.
O 8 lat dłużej niż sąsiad, który nie jest adwentystą.
The prevalence of heart attacks, strokes, and cancer in Adventists is lower than in other people. This study analyzed 73,000 Adventists of both sexes. Their diets were divided into 5 categories. 50% of Adventists in the USA are vegans. In Poland, only 10% of Adventists are vegans. These categories were the following: non-vegan, semi-vegan, pesco-vegan, a diet that includes fish, lacto-ovo-vegan, a diet that contains dairy products, and vegan. Relationship between diet and all-cause mortality and cause-specific mortality was assessed. The study lasted almost 6 years. 2,570 people died. A relationship between vegan diet and decrease of all-cause mortality and cause-specific mortality was found. 2 years ago, I met Professor Scharfenberg. He is an Adventist. He was delivering lectures as a part of New Start program. I went there with my child and my husband. Professor Scharfenberg is 90. His teeth are in perfect condition. He does not take any medicines, and he has been a vegan for 50 years. He is physically and mentally fit. He regularly exercises. He looks no older than 70. You may be still interested about Adventists and where they came from. You know about the origins of Christianity and that Christians have spread throughout the world. With time, new denominations were emerging.
Robić takie zmiany w tym, co było na początku, czyli na przykład 321. Akurat oprócz zdrowia...
I was keen on history once, so I know a little bit about it.
Znam też historię troszeczkę.
In 321 AD, Constantine decreed Sunday as day of rest.
Święcenie soboty na niedzielę, na przykład 700.
During the Second Council of Nicaea, the use and veneration of holy images were restored. In 1069, celibacy was decreed, which I think goes against human nature. In 1229, Bible possession and reading by laity was banned. Only the clergy were allowed to read the Bible. In 1517, Luther wrote his theses and the Reformation began. Protestants wanted to return to the beginnings of Christianity.
na tej fali protestantyzmu
Adventists are one of many Protestant denominations. It spawned in the 1840s.
I oni, adwentyści, wrócili do podstaw, czyli do
They focus solely on the scripture. They follow the unmodified commandments that were given to Moses by God.
Zostały dane Mojżeszowi i później niezmienione. Także tyle historii. I czy jak
Let us move on to Poland.
Stany Zjednoczone, jak w Polsce.
On one of the meetings organized by New Start, managed by Dr. Grażyna Kuczek, there was Mrs. Hanna. She had a long case history. She was 62. During her holiday, she started a vegan diet and she started to exercise regularly.
W czasach zastosowano u niej dietę wegetariańską, właściwie wegańska tam jest, również program ćwiczeń fizycznych i relaksacyjnych.
After 2 weeks, her blood pressure stabilized to the level of 130 over 80. She could stop taking hypertension drugs. She lost 11 pounds. And despite hiking every day, she did not suffer from any pains, despite having coronary artery disease.
Ona raptem niedawno przeszła zaostrzenie choroby niedokrwiennej serca.
She did not have any swellings, she could sleep normally. Her osteoarthritis pain has alleviated. This is a case from my personal experience. Mr. Jan, 77 years old, he had laryngeal cancer and underwent surgeries to remove it. He had lung cancer. A part of his right lung had to be removed. He had melanoma, hypertension, and his carotid arteries were affected by atherosclerosis. It was so advanced that he would faint multiple times daily and could not walk on his own.
On już przestał chodzić, poruszał się tylko na wózku inwalidzkim.
On February 10, 2015, he underwent carotid subclavian bypass surgery. However, the prosthesis was rejected. My husband said other arteries in the area were narrowed as well, so blood flow was blocked. 5 days later, an attempt to clear the prosthesis was made, but it failed. Mr. Jan was sent home. Nothing could be done to save him. His doctor said no surgery would help.
Pan profesor powiedział, że nic już nie można zrobić i on nie poleca nie można zrobić żadnych operacji. Zmiana sposobu.
After that, Mr. Jan started a vegan diet. He started drinking hydrogen peroxide. He incorporated false flax oil and vegetable juice into his diet. After 6 months, Mr. Jan did not faint anymore. He could walk independently, but other people had to be near him. Is changing the diet worth it? The greatest disrespect a doctor can show to their patient is not telling them about a possibility of saving their life, because the doctor thought the patient would refuse. These are the words of Dr. Colin Campbell, and I share them with you. I want to remind you that pharmacological treatment can be stopped only after consulting a doctor and changing the diet radically. Your body carries you throughout your life. It can end abruptly when you do not take care of your body. But if you do take care of your body by providing necessary substances and avoiding toxins, your body will be able to carry you a lot longer.
To nasze ciało może być w takim stanie i nieść nas długo, długo. No 50 lat dłużej niż na poprzednim slajdzie.
It all depends on what you put on your plate.
W talerzu mogą być
It can be either fast foods, which will cause diseases, or colorful and tasty vegetables, which will make your life joyful.
smaczne dania i możemy skończyć w inny sposób nasze życie i inaczej funkcjonować.
Nobody can go back and start a new beginning, but anyone can start today and make a new ending.
I dopisać nowe zakończenie.
A journey of 1,000 miles begins with a single step.
I zachęcam.
I encourage you to take the first step.
Pani Basia ma moje przepisy.
Thank you very much for your attention.
Za uwagę. Jeszcze.
One more thing.
Tak jak powiedziałam,
I have said I am a hard-working woman and no challenge scares me.
pracy się nie boję, bo dlaczego o tym mówię?
I have heard people saying that vegan meals take a lot of time to prepare.
Jest to dieta bardzo uciążliwa.
I work full-time in hospital. I commute by train. I take my child to daycare. I do the grocery shopping and I prepare dinners. Somehow I have time. I sleep 7-8 hours daily. I do not watch television though. But does anybody remember what happened in your favorite TV series 3 weeks ago? What is more important then? Your favorite TV series or your health? It is true that patients may have different opinions. I anesthetized a patient whose large intestine tumor had been removed. I went to him after the surgery to remove the intrathecal catheter that was needed to alleviate pain after the surgery. I started talking to him about diet. He told me that diet without meat and fat is no diet at all. I told him that I like my life, I have no cancer, I suffer from no pains, and my future is bright.
Przewidywalne w moim przypadku, ale nie będę się sprzeczać z pacjentami, kiedyś spotkam się z
I also met another patient who said he would rather lose a leg than stop smoking. As some people say, to each his own. Never judge other people's preferences.
Aczkolwiek mam nadzieję, że nie wyglądam na osobę, która by się chciała, która by się umartwiała. Często są też zastrzeżenia panów co do...
Men very often worry that they will lose their strength after starting a vegan diet.
Że na krochmalu i tak dalej, nie wiem, czy Państwo słyszeli takie powiedzenia. Otóż Carl Lewis, nazwany lekkoatletą wszechczasów.
However, Carl Lewis, one of the best athletes in the history, has been a vegan since 1990. He beat his personal and world records after he had started a vegan diet, so he definitely did not lose any strength.
Będąc weganinem, czyli musiał mieć siłę. Są też kulturyści, jakoś budują tkankę mięśniową na diecie.
There are even vegan bodybuilders and boxers.
To jest Arnold Schwarzenegger, który w wieku 50 lat już przeszedł operację serca.
Here is a photo of Arnold Schwarzenegger, who had to undergo a heart surgery, and his vegan friend, who did not have to have any surgery. Some people say vegan diet is expensive.
Tej diety, że to jest bardzo drogie jedzenie, droga dieta. Ja na potrzeby wcześniejszych wykładów
here we have a price of a vegan dinner.
3 kotlety z cieciorki,
3 lentil meatballs, 100 grams of pearl barley, and sauerkraut salad.
100 gramów 30 groszy, surówka z kapusty kiszonej 42 grosze. W sumie obiad na osobę i naprawdę ja zrobiłam zdjęcie, po czym
I could not eat it all. I had to give half of the barley to my son.
80 na osobę.
Such dinner costs no more than half a euro.
dlatego można sobie pozwolić na inne rzeczy.
Then you have money for other things.
Dlaczego o tym mówię? Dlatego, że w żaden
I
sposób
am talking
nie
about this
chcę
appliance
promocji
because it
tego
prepares
urządzenia.
soups very
Ja
quickly.
go używam i mi się po prostu
I make
szybciej
soups for my child.
Oczywiście ja
I use a lot of vegetables.
dużo używam warzyw i to jest fantastyczna rzecz. Są też różnego rodzaju tego
This, however, is a great thing and I encourage everybody to buy it.
się zaopatrzyły w takie urządzenia, także naprawdę teraz już. To jest multi-slicer plus. Ja akurat mam
It is a
to,
multi-slicer.
on teraz
I know there are different types as well, and they cost no more than 20 euros, shipping included.
Jak Państwo nie widzą, tutaj jest taka kratka centymetr na centymetr.
It has a small hole.
Ja kroję warzywa, czyli
I peel a carrot, cut it into 3 parts, each of them I cut in half, and then I use the multi-slicer to cut the carrot neatly.
Z jakiego źródła?
Where do I get the carrots?
Koleżanka
My
ma
friend knows
taką
where to get organic carrots,
część
so I get them from her.
źródła. No, mam małe dziecko, więc to
You
jest
can cut
fantastyczne
zucchini into
urządzenie
small
do
triangles with it,
zucchini.
and you can
Zucchini
cut peppers
się
into
ładnie
thin
nazywa.
strips if you make any Chinese dishes.
Paprykę w paseczki, jak się robi dania typu chińskiego. Tutaj do szatkowania.
If you
na
make
przykład jak się
tzatziki,
robi,
you can cut cucumbers with it
tak
into
drobniutko,
very thin strips as well.
Te ogórki na takie cieniuteńkie plasterki, także bardzo polecam. Także to
That
jest
would be
naprawdę
it.
dziękuję.
Thank you very much.